I appreciate you guys joining us. I don't know where you're joining us from, but good evening, good afternoon, good morning, depending on where you're joining us from. If you are, in the United States, let us know what part of the U.S. or if you're other parts of the world, let us know. And we're talking about how the FDA approved a new prescription weight loss management device, and love to have you guys hear about it a little bit. So again, I'm Dr. Partha Nandi. Thank you for joining us. The FDA, so FDA just cleared a device called Plenity. So, and it's a capsule that you can actually swallow. Again, if you love the stuff we're talking about, please join our Health Hero community. I have a link right there. The product called Plenity, and again, it's a capsule you can swallow. So here's how it works, right? I don't always love when you've got weight management pills. Now, most medicines and weight loss drugs work where? In the brain. They make you feel fuller, so you stop eating and try to decrease your appetite. What this does, Plenity doesn't go in your brain. It works. Guess what? This Plenity works by filling up a quarter of your stomach. The capsules are filled with cellulose and citric acid. So then these particles, once you swallow it, the ingredients expand in your stomach so you feel fuller. So it actually works in your stomach and not your brain, so it's not a drug. And I love the fact that it's a system instead of just taking another pill. So it's a weight loss management aid. And so really important. Hi to everybody that's been joining us. Vivian Spence, how you doing? Barbara Schrader. Tell us where you're joining us from as well. Roseanne Sal, please talk about morning migraines, headache. Absolutely. We'll definitely do that. Today we're talking about Plenity, a weight loss device, new prescription management device. Not a drug, but a management device, so very important. Ron Richardson, Devora Power, how are you doing? Good to see you. And Noreni Ismail, good morning here. Are you in the Philippines? If it's good morning there. And Mike Gasuski, and we'll get to that. I just want to make sure that you understand the basis of it before we talk about the cost. But so how effective is it? So a lot of people talk about lots of stuff right on social media and web. Well, the company Genesis developed this product and has presented a lot of clinical research. And in one study that they published in a journal for weight loss and weight gain is obesity. And researchers found that Plenity was much more superior than placebo. 436 adults, right, who were overweight or obese took 6 months of treatment. And what was found was that folks who took this weight management device called Plenity lost 10% of your body weight. Now that the company's on the company's site is talking about 22 pounds and 33.5 inches from the waistline. So not bad, and that is 6 months of treatment. So really important that this actually works. So again, for those who are just joining us, we're talking about Plenity, a weight loss management aid, not a drug. Super important to differentiate between the two. Now, who is this for? And what about side effects, right? So Plenity is for adults who have the body mass index between 25 and 40, and it was effective for people even with pre-diabetes. Very important. So many millions of people around the world that in our country also have pre-diabetes and elevated fasting blood glucose levels. So how safe? Very safe and low risk. Just like food, the gel goes through the digestive system. So what happens is that most common side effect is the gastrointestinal system, but most people did okay with this. And folks who should avoid this product, right? Pregnant women, anyone with esophageal abnormalities. Remember, that's the food tube here, right? Esophageal abnormalities or allergies linked to the product's contents. FDA recommends that this Plenity is paired with what we talk about all the time, good eating habits and exercise. Remember, if you can get at least 30 minutes a day, right? 5 days a week, 150 minutes a week, it's awesome. And I want people not to think that I got Plenity, I can do whatever I want, eat burgers and fries and whatnot. You want to remember this is part of a plan, very important. And remember, you should have nutrient-dense food and make sure the balanced diet is a priority. So again, let me say hi to some of the folks who have joined us here from Fort Gratiot, Michigan. and that's Barbara Shader. Welcome. Lisa Hinza from Oregon. Thank you so much. Oregon's beautiful. And Elizabeth Mary from Ohio. I love it. And we talked about side effects, mainly GI side effects, Rosanna, not bad. And we talked about, and I don't know if you caught that, but really in the 6 months, people losing about 22 pounds or 3.5 inches from the waist, not bad for a non-drug solution, right? So awesome. Insurance does not weight loss. I'm not sure. Insurance doesn't cover weight loss. I think that, I think we have to see what they do, because when a product is introduced in the beginning, they may not cover this at all. But it's far. I think, to me, it's a better option often than surgical therapy, some of the permanent stuff, and so you want to make sure that you also look at the entire picture, because surgery is quite expensive. Lots of issues that can happen as well. So I'll keep you up in touch and up to date on this. And folks, I really want all of you, if you can, to join our Health Hero community. We'll continue information like this that really affects your health. Remember, knowing more, you can do more. So remember, making health your priority and making healthy living a part of every day wherever you are. So thanks for joining us this evening or this afternoon or this morning. I'm Dr. Partha Nandi. We will talk to you on the next live. Appreciate it.